In the state of Virginia and nationally, the rate of diabetes is probably about 8 to 10%. So 1 in 10 people that you know has diabetes. In some parts of Hampton Roads, including Franklin and Portsmouth, the rate of diabetes may be twice that. So there are certainly pockets and communities in Hampton Roads that have very high prevalence of diabetes. We need to do something about patients with diabetes in the area. We have a wonderful diabetes research program here at EVMS. It's called Western Tidewater United. The reason that we're interested in focusing on Western Tidewater involves data from the Virginia Department of Health that we've seen in the past showing very high prevalence rates of diabetes in that area specifically. But more importantly, high comorbid conditions, high rates of mortality associated with diabetes in Western Tidewater. It's a very expensive problem for the regional healthcare system also, because all of these things are very costly. And Western Tidewater has a significant number of individuals that are obese, that are older, that have problems accessing food, and some other risk factors living with diabetes and succeeding with diabetes. There are 2 components to the Western Tidewater Project. The first component involves doing diabetes screenings in various areas throughout Western Tidewater. We check people's average blood sugar, their glucose, their blood pressure, and then provide education for all of those folks about their diabetes or pre-diabetes if that's what they have. One of the benefits of the screening program is that we follow people that test positive for diabetes. We try to provide those resources, and then we're following them longitudinally to see if they benefit. The second piece involves identifying people that live in Western Tidewater that are frequently going to the emergency room or to the hospital for diabetes-related reasons. We're trying to understand who those individuals are and what barriers to care they have and how we can help them so that they don't have to use the hospital for what really should be primary care. One of the goals of the Western Tidewater Project is to continue our multidisciplinary work and to use the data that we obtain to bring some national attention to the work that we're doing here in our community. It would be very difficult for us to do the important research and community work that we do at EVMS at the Diabetes Center without our donor support. Organizations like the Cosmopolitan International Group and the Cosmopolitan Club of Norfolk provide funding to EVMS that allows us to develop projects like the Western Tidewater Project we're involved in. And without resources from donors, it would be difficult to do screenings outside of Western Tidewater, including in other parts of Hampton Roads. In order to better treat diabetes and understand diabetes, you really have to know what's going on in your community and how we can help reduce those barriers.